Hi, beautiful people. It's Wonderful Wednesday. I'm April Roll, your ER doctor online, and today's video is about cervical health awareness. So if you are interested in learning more, this video is for you. First, I want to talk about what is it? Cervical health involves the health of the cervix. What is that, you ask? Well, we're going to get real technical and specific right quick, so don't be shy. The cervix is the opening to the uterus from the vagina, or the opening to the womb from the vagina. Meaning that's the opening that babies come through during vaginal delivery, and that is the opening that your period comes through during your menstrual cycle. So that is what we're talking about, the health of the cervix. Why is this a thing? Why is Cervical Health Awareness Month even a thing? In the United States, 13,000 women are diagnosed with the cervical cancer per year. And of this number, around 4,000 women unfortunately will die from cervical cancer, even though cervical cancer is very preventable. What kind of things cause cervical cancer? The main contributor to the cases for cervical cancer is HPV. 91% of the cases of cervical cancer are caused by HPV. And HPV stands for human papilloma virus. It's technically categorized as an STD. You can get it other ways, but it's categorized as an STD and is one of the most common, if not the most common STD, because you don't have to have symptoms. You can have, many people either have had HPV because the body can clear it, and many people are walking around with HPV and they have no idea. So they are transmitting it between people that they are sexually active with, and they have no idea. They're not doing this on purpose. They're not trying to, pass you any kind of specific virus or disease, because they don't know. But yes, HPV is the cause for 91% of cervical cancers. There are other things that cause it, but this is the main one. So how do you prevent cervical cancer? The two main ways for preventing cervical cancer I'm going to talk about in this video. The first one is vaccines. Okay, HPV does have a vaccine, and it is recommended in children ages 11 to 12 because that's when the immune response is the strongest, and that is when it's recommended. It's recommended in both boys and girls, even though you may be thinking, okay, the cervix is for people who have uteruses, and that's mainly, people who are born female. But HPV can affect women and men, boys and girls. Therefore, it is recommended to, be given to children ages 11 to 12. The vaccine is available and can be given up to age 45 in both men and women, again, because I said HPV affects both men and women. The other thing, the second way, which is very important as well, is early detection. And how do you do this? During your well women's visit, you get a pap smear. Age 21, so if you are watching this video and you are age 21 or above, you may have already had a pap smear, and that is where at your well women's visit, your OBGYN would swab the cervix and send that swab for testing. What they're looking for in that test is what kind of cells are on your cervix or in your cervix. Are they normal cells? Are they atypical cells? Are they precancerous cells? Or are they cancerous cells? So during this pap smear test, they're looking for these things, and basically if they find that you fall into the atypical or precancerous or cancerous, they're going to intervene accordingly and provide you with options for treatment. The reason why I'm saying cervical cancer is very preventable and there is a cervical health awareness month is because it is preventable. Cervical cancer, or should I say, the atypical or precancerous cells do not rapidly progress to cervical cancer. So there is time in between you having an abnormal pap smear where your physician can intervene and they can stop the progression to cervical cancer and therefore prevent you from getting that. So those two are the main reasons why HPV vaccine and early detection are two main ways to prevent it, because HPV causes 91% of the cases, and as I said, the progression to cervical cancer is usually slow. So early detection by pap smear and regular well women's visit will be able to prevent cervical cancer. So sometimes, because everybody's not able to make it to the doctor yearly, or, some people haven't even been to the doctor in years. So how would you even know if you potentially could have cervical cancer, or what are some of the symptoms? These symptoms of cervical cancer can include abnormal bleeding. And when I'm talking about abnormal bleeding, it can be either in between your menstrual cycle, you're having irregular bleeding. It can be during or after sex, you're having bleeding, or it can be after menopause, you having bleeding. Meaning like your uterus shut down, out of business, no more periods here, and then all of a sudden you start bleeding. That could be a sign of cervical cancer. It could be a sign of many other things, but this video is about cervical health, so that's why I'm bringing this to you. That is one of the symptoms. Another list of symptoms is pretty much anything to do with pain. So if you're having pelvic pain, or if you're having pain during sex, those are also symptoms of cervical cancer. So I just wanted to bring that to you all. If you haven't been to the doctor in a while, or you don't get yearly checkups or anything like that, these are symptoms that you can look for that indicate, no, you need to go see your OBGYN or some type of provider for evaluating your cervix. I hope that all of these little bits of information have helped you in some kind of way. I tried to, have it be really concise and really summarize and give you the gist of cervical health and things you should be looking for, things that you should know. I like to arm you with knowledge so that you can take care of your body, own your own health, and be healthy. Share this information with a family member, with a loved one, with a friend, so that people are aware of the things that are going on with their body, and when there is cause for concern and need for follow-up with a healthcare provider. I hope you learned something in this video. If you did, like and share this video. If you have any questions or comments, please put them in the comment section below, or if you feel more comfortable sending me a direct message, you can do that as well. But I am so glad, I appreciate the fact that you all share these wonderful Wednesdays with me, and I'm glad you shared this wonderful Wednesday with me. Be blessed and stay healthy.